In the tapestry of life, where every thread holds a story, America in black and white emerges as a haven for the voices echoing through the heart of our communities. In this podcast, we wade through the rivers of our collective experiences, celebrating the vibrant hues of change brought forth by the whispers of hope and the roars of action. It's more than just a conversation. It's a journey into the heart of our society, illuminated by the light of those daring to dream and do. Join us, and let your voice be the melody that guides us toward a dawn where every color finds its place in the masterpiece of our shared destiny. Together, let's paint a future brimming with the positives that dwell in our minds and the actions that shape our world.
Good evening and welcome. Let me say something to you plainly right here at the top of this show, because this is not a program where we soften truth for the sake of comfort. The health of a nation is not just measured in hospitals and prescription rates. It is measured in who gets to live, who gets to be treated, and who gets to be seen by the very systems that were built supposedly for everyone. In America, the color of your skin has always determined the quality of your care. It has determined whether your pain is believed, whether your diagnosis is timely, whether the medicine that could save your life was ever designed with your biology in mind. That is not a conspiracy. That is a documented, peer-reviewed, historically confirmed truth that we talk about right here every single week on America in Black and White. I need you to understand something. Black excellence in public health is not just professional, it is political. It is personal. It is revolutionary. Every Black man or woman who walks into a boardroom, a health department, a nonprofit headquarters, or a federal coalition meeting and refuses to leave their community at the door, that person is doing something radical. They are saying, I will not separate my credentials from my calling. I will not pretend that data is neutral when the data is about my people. I will not dress up a career in the language of efficiency while ignoring the moral emergency that gave me a reason to show up in the first place. That kind of courage, the courage to lead with both the mind and the soul, is exactly what American Black and White was built to celebrate, to interrogate, and to amplify. Tonight, we have in our company a man who embodies that courage in every dimension of his career. He is a nonprofit architect, a public health strategist, a patient advocate, a builder of boards and bridges, a trainer of leaders, and a man whose intellectual lineage runs from the HBCU halls of Tennessee State University all the way to the corridors of national coalition work on personalized medicine. His career is a living bridge, a bridge between data and dignity, between policy and people, between the research lab and the living room of a patient who just got a diagnosis that changed everything. He has stood in the gap for communities battling HIV in America's South. He has amplified voices in the multiple sclerosis space, and today he is shaping the future of how we think about medicine, not as a one-size-fits-all system, but as a something precise, something personal, something that ought to reach every single community, regardless of zip code, income, or race. This show exists for moments like this one. American Black and White holds space unapologetically, consistently, fiercely for the voices, the stories, and the truth that reshape the American narrative. We're not here to be comfortable. We're here to be complete and complete the picture of Black leadership in this country. means making sure that the men and women doing the quiet, difficult, transformative work of systems change get to sit at the front of the room and tell their story on their own terms. So without further delay, let me bring to you a man who is redefining that public service, what public service looks like, what Black leadership sounds like, and what it means to dedicate a life to serving a community through strategy, advocacy, and unshakable sense of purpose. My guest tonight, Mr. Darion Banister. Hello, sir.
Good evening. Thank you so much, Mr. King. You make me sound real good. I'm like, my mama needs to hear that one.
So how are you, and welcome to the show?
I'm wonderful. Thank you for having me. It's such an honor to be here.
So before we get into the show, is there anything you'd like to say to the audience?
I just want to say thank y'all for being here. Thank you all for tuning in to hear what I have to say. I'm just a simple man, just wanting to be there to support my people and to see us success in all aspects, and to live a healthier life. There's been a lot going on, but I just really want to encourage us all to be healthier as best as we can.
So as we get into the show tonight, I want to say thank you to each and every individual that's already tuned in, and for those that are with us for each and every show. And I want to thank you all so much for this support. So when we start the show, what I'd like to start off first, sir, is I would love to have the audience get the opportunity to learn a whole lot more about you. And so I call this, the man behind the mission, your life story, and your origins. So take us back to the beginning. Where did you grow up, and what did the world look like for you as a young person? Paint me that picture of where Darion Banister comes from.
Oh, well, that's a good one. That's an easy one. I grew up in the Midwest, so small town, college town, if you will. So depending on where you're from, if you're from, the South, you can think of like Athens, Georgia, or if you're from up north, Champaign, Illinois is actually the city. So it's a big college town. While it was diverse, it was still hard to just see folks that look like me in different aspects. I would see us in, we had principals, we had superintendents, even police chief, but still on a day-to-day, it would just seem like it was far and few between that you would see and recognize professionals that look like me in all aspects. Outside of education, when I would go to the doctor and in healthcare, I wouldn't see that. The city I grew up in, super diverse, I would say it was a medium between very liberal and conservative at the same time, but it felt safe growing up. I will say that it definitely felt safe. It was the 90s, so not trying to age myself, but I grew up. I am a 90s baby, so I am a millennial, just FYI.
So who were the earliest people in your life? Family, neighbors, community members, maybe a teacher or a coach, who first planted in you a sense of purpose and responsibility toward others?
I had to say, it was probably my grandmother and my mother. They were, my mother's still with us. My grandmother passed on, but one thing about her that she always taught us was to give back. Whether it was donating time at the church, whether we're donating food items for pantry drives. Every Christmas, we would get together and go buy toiletries to give out to the shelters. We make baskets to give out to, just the neighbors and then other shelters down the street. I always just grew up that it's important to give back, that, you've been thankful, you've been giving so much, to whatever higher power, higher being you may believe in, that you have been fortunate to make it to where you are and to have the abundance that you do. That I always told you have to give back and give forth. So it definitely started as a family thing. And then even my father, honestly, most of my family, they're all public servants. So it just kind of felt natural that this is just what you do. This is what life is. You do well and you support others.
And so as you think about that from then as you were growing up to now, Tell us, what are some of the things that have stuck out the most for you that you still carry today that makes you that public servant that you are today?
Treat people the way you want to be treated. That was the first thing I was taught at home long before I got to Mrs. Davis kindergarten class. I do remember that far back, but it was always to treat people the way you want to be treated. To give respect, to get respect. So that's something I would always want to give others what I would want. That's how I live my life. When I think about care, when I think about treatment, when I think about access and knowing information, if I would want to know this information, if someone knew, I want to pass it on. If I had this resource, if someone had this resource and I needed it, I would want someone to share with me or someone's family member, or just to give an extra hand when someone has a phone call, just, hey, I need to talk to you. I don't know where to start, but I know you may know an inroad. That's just how I operate in life. And I've always just been taught it feels better to like give out, to pour out. You receive some as well, but it's a rewarding feeling to still give to others. And I think that's been like my guiding principle in life.
So, what was it about public service that called to you? When did you first understand that your life was going to be oriented around building something for someone else, around community, around equity?
Probably in middle school. I think it's when it fully sunk in. I always had a love for politics, economics, history, and health just somehow just fell into there. I'd never thought I'd be in the public health realm, to be honest. I was always good in science, but I always thought I'd be somewhere in politics. And it was definitely around middle school when now President Barack Obama, at that time, who was running for our state senator in the great state of Illinois, where I grew up, that I knew that I think life in public service would suit me. I was like, I wanted to follow in his footsteps at one point. I'm like, maybe I can be, if he's going to be senator, then I can be governor. I was like, I'll go on to be president. I thought I was going to be the first Black president, but it's okay. He can take it. I'll become something. I don't know if I want to run in politics anymore, but when Michelle Obama, hopefully, maybe she runs president, she'll pick me for something.
So, look, tell us about that middle school moment. What was it about middle school that gave you all of this feelings of all these things that you could be and these things that you could do?
It was, as much as middle school is always like hard, I think, for a lot of kids growing up, but something about eighth grade, it sunk. It just, life made complete sense. I had a great middle school. Like our teachers were amazing. Funny enough, I'm actually still close to a few of them now, just because they wanted to see us grow up. Everyone from my U.S. history teacher, still close to him to this day. He instilled in us so much about politics and history and being activists and advocacy and what does that look like. Learning those words from him and just like, no, you stand up for your right. If you don't believe this is fair, you right say that wasn't fair, including if it came down to like student council, something at school. And he was about that. He shared that this is what you do. Even the administrators that I had, I'm funny enough, at the time, the assistant principal who's now a superintendent, her and my mother are still very close. So it just, I always felt that I was supported to chase after my dreams, to think about what life could be like, to be that servant. They just said, this is who you are, and it just felt right.
So, growing up in the South as a Black man, how did that geography, that history, that particular cultural and political weight shape the way you understood race, community, and personal responsibility?
So I didn't completely grow up in the South. I was Midwest, but my family roots, my father's side is from Baton Rouge. My mother's side is from Vicksburg, Mississippi. So if you know anything about the area, we're talking about down in the Delta area, right? We're talking deep South. Well, I grew up in the Midwest, and if folks know anything about Illinois, especially Chicago, they used to call it Northern Mississippi. And If y'all caught that reference, then you know. For those of y'all that didn't catch that reference, it was a lot of similarities between the Midwest and the Deep South. Um, One thing that I've always noticed, because we always went back south every summer, I spent summers between Mississippi, Texas, Virginia, um, Tennessee as well, that it was apparent in the South as far as, what line you don't cross. But growing up, it was always, you could never be sure. I remember, I was at one point one of the only brown kids a part of an organization in middle school. Um, and I remember we were with like some adults at this volunteer thing, right? And I can just remember a woman, very, very politely, just like, oh, you're just so brilliant. You're just so wonderful. I'm sure your parents are very proud of you. You're so well mannered. And it was almost specifically to me and not my other classmates that I knew what she meant, and to know that, oh, there is a difference between me and some of my other classmates, and what does that look like? Versus, I think in the South, it's always been pretty much, we love you or we don't. Midwest, it's always been, I've had one in my home once type, and that's my friend of color. So that's where I really started to realize that race. I always knew that race mattered, but I learned the difference. How to walk in those rooms and situations. I'll say that. That's PT. Yeah.
Yes. Well, no, that's definitely understandable because I think a lot of times, especially it doesn't matter if you're like Midwest, Northwest, you could be Southwest. I think what happens when you get to that whole entire line of the South,
Hmm.
Southeast, and to the extent where you get close to the Southwest, culturally it's just totally, totally different. And for a lot of young kids that come from other places, it's one of those things that is more than just culture shock, but it kind of like pushes you into an area to where it's confusing.
Hmm.
So, on your summer trips, when you guys would come and visit, I mean, did you ever see any differences that kind of like gave you pause?
Well, one difference that I think I felt like when I would come down south in the summer, everyone played together. All the race, like when I say we all played together. We were all in the same neighborhood, and everyone would play together. And it was, oh, we had summertime friends. Oh, we can spend the night. Oh, they can come over here. You know, I don't know how some of y'all grew up, but definitely growing up, everybody, you can play with certain people. They can come over, but then they gotta go, or you can't go over there. Or like y'all
That's
can play at school, but they can't come over. You can't come over there. The line was drip, was very, very much in the sand. But it just seemed like we all played together. It was it was okay. It was normal. Versus at times, I think back home it was almost, huh? It was almost intriguing to people, I could say.
right. What was the defining early moment, a decision, an experience, a conversation that you can point to and say that this is the moment that set the trajectory of who I am or who I became professionally and personally?
I want to say it was want to say in third grade. My grandmother had been sick. So by this point, I saw that she was sick and she was down and out. So to know a little bit about me, to know my grandmother and that was my best friend. Like right here, I'm gonna just say for whoever needs to hear this, I was the favorite. I know that's always a joke, but no, I was the favorite, and everyone else will tell you, no, he is the favorite, so it's clear. But so they knew that we were thick as thieves, and she knew me like the back of her hand, literally. and she had gotten sick, and I didn't realize, I didn't know at the time what it was, but she had been sick for before. She was living with lupus. And I don't know if folks are familiar with lupus, but lupus is an autoimmune disease, and it affects predominantly Black women. More and more Black men are starting to be diagnosed as well, but definitely predominantly the African American community. And at the time, they didn't expect her to live as long. That's one thing. Lupus never. That's the thing funny about it, that lupus did not take her out at all. That she would be 102 with lupus and still kicking butt. She was diagnosed way back in the 80s, but to see how much she went down and how it would hurt her, how I had to help her. I ended up having to cook for her, having to clean, just literally seeing a woman that was so strong being frail, and to learn. Then I started, being nosy, because we had the internet and we had AOL. Started learning more about the disease and what it looked like. And it was the 90s. I started hearing more and more about HIV. And I was like, oh, and I found out they're all autoimmune diseases. So I'm like, this is actually the moment I can actually tell you. I was in third grade. It was like science class, Mrs. Patilla science class. We were just in science, and I just had an idea. I'm like, hey, we doing a project? Say, hey, I got an idea for, some science project. She's like, okay, what you thinking? I was like, yo, so, there's autoimmune disease called HIV, and then you got lupus, autoimmune disease. There's more testing and studying over here. Why don't they just switch the medicines and see if it works? And literally, I can remember the teacher looked at me dumbfounded, like, you're right. I don't know why people don't do that. That's something to think about. Just did not know what to say, because I'm like, what, 8 years old, and I had this profound idea, and nobody knew what to say. And from then, I just kind of, I don't know, health had just always been a part of me. It was pretty much then I knew, okay, something has to be done. Don't know when, don't know where, but something has to be done.
So, if your younger self, the young man just figuring out what he was built for, could see the work you're doing right now, the career you have built, the communities you have served, what do you think he would say?
He would say, wow, this is definitely not what I thought we'd be doing. This is not where we thought we'd be living. But you know what? This absolutely makes sense and tracks. I had to look younger. I thought I told you, I thought I'd be a lawyer. I thought I would be running the country. I thought I'd be governor of Illinois. Definitely thought, I was like, oh, I'm going to be something different. I'm going to be in Chicago in a big law firm in this big glass office. Like, I had this whole thing planned out, and I would do so. I don't know, but it turned out completely different, but made some of the best decisions I could have. And I think the younger me would be absolutely proud that we got here.
Wow. So let's move over to the HBCU Foundation, Tennessee State University, and your academic journey. You chose Tennessee State University, a proud, historically Black institution in Nashville, Tennessee. Walk me through that decision. What drew you to an HBCU at that moment in your life?
Well, I, came from a college town. So while it was diverse, very much still the minority, a lot of classes, I was still very much the minority. I wanted the experience. I'm like, what does the majority of us look like? I used to go to the Circle City Classic in Indianapolis often, and I would see Tennessee State. We had a program back home called Champaign Urbana Day, and actually some HBCU bands back in the day. Morris Brown used to come when they used to march in the parade. It was actually used to be like during Juneteenth. It was like our celebration long before, Juneteenth became a federal holiday. It was a thing. They moved to August, but it was like an amazing thing. They used to come hometown, and I was just like, oh no, I got to go to that school. Look at how they're marching. Look at how they're playing. Because at one point I used to play in the band, and it just felt right. I toured a few as we call them, PWIs, primarily white institutions. No offense to any of them, but didn't fit right. I tried a few HBCUs, went to some other schools as well. Not gonna say any names. Don't want to bash anyone, even though I went to the ultimate premier institution. When I got on campus, something about when I got to 3500 John A. Mary Boulevard, I turned on the campus, walked through the door, you saw that big tiger right down there underneath the airplane. If you know the school, you know where I'm talking about. Um, it just felt at home. Something about, when I toured, when I met other students that were there, it just felt like home. Everyone welcomed and said, "Welcome home. We'll see you in the fall." And literally, there are some friends of mine from college that I remember when I came to tour that we are still friends to this day, and they remember that.
What can you tell some of the younger kids that are looking to go to college now? What can you tell them about the HBCU experience? What should they expect, and why should they go to an HBCU?
Well, for me, it's no other choice. I mean, it's the when you go to college, there's some of the best years of your life, and I do mean that. Like whenever anyone tells you, just know when they say some of the best times of your life, it is some of the best times of your life. And honestly, why not be surrounded by your community that's going to love you, wrap their arms around you. They're going to hold you accountable. They're going to push you, and they're going to make sure you succeed, and they're going to check up on you. Why not be surrounded by your community that will uplift you and share you and cherish you, and to make sure that you're going to rise to the top because they want to see you succeed. They love you in a different way, not just you're here so we get a check for you being here, but they love you because they see the greatness in you. Why would you not want that? I can tell you, I am still close to my freshman year biology professor. She became a second mother to me. And for situations like that, is why not at HBCU? Class of over 50 students, and we are still connected. All schools, you don't get that in some of your freshman and sophomore year, your general ed courses.
Right. So, what did the HBCU experience give you intellectually, culturally, and spiritually that you genuinely believe you could not have found at any other type of institution?
That I can succeed. That there's no challenge that's too great, and never take no for an answer.
Mhm.
They taught me to believe in yourself. You walk in the door with your head held high. You let them tell you no.
I like that. I like that.
You let them tell you no, no matter what it is, no matter what you're going for, no matter what you need, whether it's a loan, you want to buy that house, you're getting the car, you want to get the job. Like literally have that in your heart. Like no, have the confidence. This is my why not? What do you mean? You know your things when you're ready. You know. You let them tell you no. You don't count yourself out. And even when they say no, like, huh, are you sure? Like sometimes that no is not the no until everyone says no. So that's one thing they said, keep going until everyone says no.
Mhm. So, you studied political science as an undergraduate and went on to earn your master's in public administration.
Mhm.
How did that combination of politics and administration shape your understanding of power, who holds it, who is denied it, and how it can be redirected towards equity?
It just made sense. Honestly, the study of political science is really the study of politics, which is the study of economics. And once you understand that a lot of policies are created by economics, it's not necessarily party affiliation. There are some moral stipulations in between some of them, but a lot of times it really comes down to where the money is spent, how much money is coming in, and where should it go, and who decides it. And it's honestly a little bit. It's really that simple. I know that sounds like really simplified, but it's honestly that simple. Politics is really created by economics. Like follow the money. If you look at any of the budgets, a budget. One thing that I got taught specifically in studying my master's public administration, one of my professors said I want to teach you this in budgeting, that you can look at any organization's budget and you can tell whether they're doing what they're supposed to be doing, if that's what they're saying they're doing, by looking at their budget alone. And now you can, because you can start to calculate how much money goes to staff time. Of course, that's going to be a big cut. You want to talk about benefits, like that's going to be a big portion, but also looking to see how much money is going towards programming, if that's what you're doing. You know, how much money is going out to supportive services. Like, you can start looking at the numbers and make it make sense.
You know, now I want to say this because what's interesting is when you mention public administration, I want to tell you that you're the second gentleman that's been here on the show that's got an MPA. Normally, when you think about MPAs, it's really a female dominated area.
Mm-hmm.
And what I've noticed as of lately is that there are an enormous amount of men, especially Black men now, that are going into public administration. Tell us about that experience in public administration and what that really means.
You know, it's really serving the people. So a lot of folks that are, if you're in like nonprofit or government, public administration just makes sense. It's an older degree than people think. It's been around for a while, because folks will often say the first public administrator was really Thomas Jefferson. That's getting into philosophy, so I'm not going to go down there because I'm not those folks. Because there's a lot of us that actually have a doctorate in public administration. They keep trying to call me to do that. I don't think I want to, but really, it's the study of like, how do organizations operate? Like, you know, a lot of people also have like, you know, a master's operational leadership, organizational leadership. There's a lot of programs. It is not too far off of, honestly, public administration, if you ask me, because the thing that I really learned was how to run an organization. Everything from like your budgeting to your personnel, to your planning, your research phase, your evaluation, how to also build programs, how to disseminate the items. You know, we had a communication class. How do you disseminate? How do you make sure you're writing a memo? It's, you know, often it's specifically used for like, you know, public work, public trust. Like if you're, you know, at a bank, if you're at, say, a foundation, how do you support public interest? But also even when you think about private, because it's just, when we think about what motivates different employees, you just turn one switch or the other. So I see a lot of folks actually with public administration degrees, also in the for-profit sector as well. Because if you're working with the public, it just makes sense that you should have someone who understands how policies may work if you're looking at getting city contracts, government contracts. So it's just, it's a lot of us around in a lot of different areas, funny enough.
So, were there specific professors, mentors, or scholars you encountered at Tennessee State who generally shifted the way you saw the world and your own potential within it? Tell me about them.
Oh yeah. So like I said, Dr. Martha Walker Stratton, who taught biology for years, who I told you became my second mother, really loved and supported me and took me in. And she was hard on me, but not to the point that I couldn't do it, not to the point that I was getting beat up, to the point that like I knew I was capable of more. I think about Dr. Kara Robinson, who actually, funny story about her, I absolutely love her. I've actually had the chance to work with her after graduating because she's phenomenal. But she was the first professor that called me on my BS. She knew. I gotta tell you, I love to tell this story. She can't stand what I do, but I do it anyway. So, you know, I was one of those because I thought I was smart enough. So I could write a paper like the night before, turn it in because it was due like 11:59 on your e-learn. If anybody remembers e-learn, I started it at like 7, 8 o'clock. Got it turned in, however many pages. I came to her office and I was like, yeah, oh, I couldn't believe I got a C on this paper. I'm like, how'd I get a C? Like, I don't get C's, you know? Like, I don't get C's. So I went to her and she said, you know what? Let me tell you something, Darion. She said, this is your C work because I know that you did this last night around 7, 8 p.m. and got it turned in on time. She said, for your other classmates who have worked hard and spent weeks researching and writing, this would be their A work. But I know you're capable. If you just put any type of effort, you can give me A work. And I was stunned. I honestly, I had to take it to the chin. I think I actually ended up with the C in her class overall, but we're still this close to this day because she challenged me and she wouldn't let me get away with BS, and that's why I kind of have to put a little effort into things now because I haven't been called on that.
So, your minor in nonprofit management and leadership feels almost prophetic given where your career has gone. What did that coursework teach you early on about the relationship between mission driven work and the structures we build to sustain it?
They go hand in hand. That you know, if if your structure is not in line with your mission, then you will not succeed. If you are not if you are not shaping and building your organization according to your mission, if you're not always evaluating your mission statement, your vision statement, checking your board, strategic planning, that you will fail. You will start. You may wander off into I'm gonna say another dimension, to an area that does not serve you, or that wasn't your initial purpose. And it's okay to grow, but how do you do that strategically? Are you still serving the people that you say you want to serve? If the impact has changed, are you still serving that same community? And then why? Um, it really taught me that your first step before you do anything when it comes down to service and nonprofit, and it's about your mission, and your mission has to stay forward. You have to be mission driven in order to truly succeed.
Now what's key to what you just said, I think it should stand out, especially, when you first get into a college or university where everything is about mission. Can you explain to us and tell us why is the mission so important?
Because the mission is the goal. It's what you decided to do. It's the whole reason that you exist. So if the mission of, say, like you said, a university is to bring students in order to educate them and graduate them, and so they succeed and they succeed in life and they want to come back, then that means you want to be instilling in that student as much resources as you can. Your mission should still stay to, okay, let's support this child and make sure, okay, they can get what they need. They don't have the money to pay for their books. What are we going to do to make sure this percentage of students gets their books? Because you're staying true to the mission. That may mean you grow into another arm. Say, okay, that's when we start having all of these endowment funds where we need folks to donate. So please donate to your endowment fund, folks. But you're still building your mission, and I think that's why certain schools are actually so successful. Because I have to give it up to Morehouse and Spelman, because they stay true to their mission. You know, and also, that's even when you think about other large nonprofits. When I think about Susan G. Komen, they're true to their mission. Their thing is about breast cancer research. And they may add other arms to support other oncology efforts, but because they're true to their mission to support every woman, actually not everyone, every person that may develop breast cancer, because there are, not to mention, there are several men that are also living with breast cancer. It's a small number that isn't talked about, but the numbers are starting to grow. But you stay true to your mission, and you see how you succeed.
So, for young Black students who are weighing their options right now, HBCU versus PWI, what would you say to them based on everything your Tennessee State experience gave you?
I would say so. I'm a fair person. I'm a Libra, so I believe in being balanced. So I got to be completely honest. Why I am biased towards my HBCU, I gotta level head with everyone. So I give everyone everything. So from my HBCU experience, my network, because of my school, is phenomenal. I do have other colleagues, other friends, that also identify as African American, that may have went to some other PWIs. It doesn't seem like their network is what's the word I'm looking for? May not be
Rich.
there we go. May not be as, and I just, that may just be them. But one thing about, we're very close knit. Every major city, for whatever university you went to, your HBCU, there's a chapter there, and they look out for each other. They're going to get you plugged in. They find out you went there. Somebody finds out, hey, my auntie went to TSU. How can I help you? Or they went to mine. If they went to Jackson State, you see them on an interview. We may talk about each other, but it's a connection just on the strength of, you went to another HBCU, so I want to support you. Like, the way we were taught to connect and network and to think and to be on our toes, I think is unmatched. And honestly, we still produce the most doctors, lawyers, PhD researchers, congressmen, more than any other school, African Americans, I should say, engineers as well. And you can just check. I mean, it's just facts at all HBCUs. But I will also say that the caveats, so say looking at, say, another PWI, like a lot, you can look at, say, a Duke or Vanderbilt or Emory, not necessarily sound, but Tulane, Northwestern, some schools, especially if they're paying, if you're getting a full ride, hey, I can't, in this economy, you get a full ride, go for it. But the other thing, if you're going for some of these schools, you have to make sure, you have to be intentional about creating your network and intentional about staying focused and how you can and find your support system there, really. Because I've heard stories from other folks that have been to larger universities, and they often felt lost in some of their first classes, freshman, sophomore year. They felt really lost in big rooms and not necessarily knowing anyone, or even having one-on-one time with the professor, versus, when I think about it, if I walked in the room late, they knew. It may be 50 people in the room at our largest class, but still they would know, and they would call you by your first name. And that's just something that it meant a lot to have that one-on-one connection. So it's up to you, but those are just certain things that I would be honest. And once again, I still say you're not going to get the support and love, the reassurance. And I have to say, I feel like the network at an HBCU, like you'll get at a PWI.
Let's, I appreciate that answer, because that right there in itself was more than just wholesome. It's one of those that's thought provocative, that puts that thought process and that seed that it's ooh, I need to let that seed grow. Let me put some water on it. Let me see if it grows.
Look, I'm also a teacher, so I want to make you think too.
So let's transition over to your work in project management, organizational capacity building, and your nonprofit leadership. Let's break this down for our audience. What does organizational capacity building actually mean in practice? And when you walk into an organization and begin that work, what are you really looking at and trying to change?
Yeah. So what it means is, I'm building the capacity of a nonprofit to serve, to operate, to serve more people, to gain a following if it's communications, to secure more funding is what that means. One thing that I'm definitely looking for when I first look at an organization, because I do some consulting on the side, is the first thing I'm looking at is your board and your mission. Is the work that you're doing aligning to your mission that you gave? Is it aligning to your vision? And then also looking at, where you are with your board. Is your board supporting you? Because one of your first line of defense as an organization is your board of directors. It's your absolute board of directors. They should be your champions. They should be the ones, advocating for you. They should be the ones helping to support funds. They should be, telling people about you, bringing you to events. Your board members really do hold a lot of power, and there's a lot of support, and it's a lot of comfort that comes from having really strong board members. And when you have really strong board members that are invested, the sky is the absolute limit.
You served as a lead trainer at Emory University, providing training and technical assistance to nonprofits across 12 states. What did you learn from that kind of breadth, seeing so many different organizations across so much geographic and cultural terrain?
Everybody had the same issues, no matter the size of the organization, whether they were grassroots and it was one person that just wanted to do some work, to a multi-million dollar organization that had like 60 to 100 staff members. That everybody had some of the same issues, had some of the same thoughts and the same complaints. That it really just turned out to a lot of times. It came back to strategic planning. It came back to, good old fashioned, let's go back to our mission. What is our mission to do? How can we serve? And let's get back to, grassroots work. What I've seen recently, a lot of the big organizations, while they're still doing well, but a lot of the grassroots organizations, the small mom and pop, two or three people that you may have heard, somebody that just decided to do work. We all had that lady in the neighborhood that just was about the community, that wanted to do something at the center. Those are the people that are really reaching our hard to reach communities and really doing a lot of support. Even though we have social media, it's a great tool, but some these algorithms now, they've gotten a little smarter, so everyone still may not get your information. So it's something about that hand to hand touch and just being right there, out that street advocacy and outreach, that's really still making waves.
So, in your experience working with nonprofits of all sizes and missions, what are the most common, most costly mistakes that nonprofit leaders make, and what does the path out of those mistakes actually look like?
You know, One thing I used to love teaching, some grant writing classes, and really my thing was really prospecting versus the actual writing the information. Great guy who does that, but it's almost over promising and under delivering, I would say. We see the size of certain grants, and sometimes we may write, it's for $100,000, and we're writing 5 or 10 deliverables. That's a lot of work to do. That is 10 deliverables, depending on what they are. That's a lot of work. You know, I'm one that I like to recommend up to 3 deliverables max, to be honest, because I would always rather, under promise and over deliver, because that just makes you look good. And that means that then you have a relationship with that funder and they may want to continue to fund. You don't want to look bad and not communicate what's going on, why the work isn't being done. Lagging on the timeline is never really that great, but sometimes you can work that out. But having too many deliverables and not being able to deliver on those, to make some of those promises, that just doesn't look good, and nobody likes that. And then you don't want to get a bad name out there. So that's one thing that I definitely always, that's what honestly starts the slope. Um, it's promising, the world, and honestly, you don't have to. You don't have to do more. Some grants, honestly, you can just have one deliverable and get paid. And I've seen it.
So, would that be depending upon the work and how you do the work?
Depending upon the work, depending upon the grant, depending on what you do as an organization, what you're capable of doing. You can offer more deliverables. I'm not saying you to not to only do one for everything, but depending on what it is, you don't have to break your neck for such a small amount of money in the grand schemes. And if you hear that, you hear, like, depending on the size of your organization, like $100,000, that sounds great, and it is great. For like when you're starting out as a grad, it's really amazing. But also keep in mind, where does that go to, and how do you break that up, and how do you budget that out?
Um, you have done significant work on board development. Walk me through your philosophy. Why do boards make or break an organization? And what separates a high functioning board from one that is slowly suffocating the mission it is supposed to protect?
Oh, that's a good one. Goodness. you know, what I look for when I think about a board is diversity, to be diverse within your board. And when I say diverse, bring different skills. Everybody on your board doesn't have to be, say C-suite executives, and giving funds. That's great. I'm not saying it's not. It's great, especially if they're funding and they got some connections. But sometimes you do need people that are connected, that have a voice, that have connections to other companies that may be able to sponsor, that can fund some projects. You maybe need someone who's connected to community as well, who can bring people out if you're hosting an event, hosting a community event. Think about some people that, like, depending on, I come from healthcare, so I think about patients. I love to have. I think it's important that when you're thinking about healthcare, that you have like a patient or two voice that's a part of the board. Because if you're offering services to someone, where's their input? Stakeholder engagement is a really important thing for me. And I just feel like, you can't do anything without me. You can't just, I was just thinking about something in history. I'm thinking about how they carved the continent of Africa and just did it without anyone's permission. That's essentially what you're doing when you're not including people that you're supporting. You're creating things that if they didn't ask that they needed. So those are things when I think about a high functioning board and people that you need. You want people that can bring their skills and aren't afraid to help and lift their hands when they can, that are volunteering to support. If it comes down to getting a donation or asking for donations from somewhere else for a charity event, those are the reasons that your boards can really sink or swim you, to be honest.
So, executive coaching is deeply personal work. What has coaching other leaders taught you about your own leadership, your own blind spots, your own growing edges, the things that you had to sit with and reckon with in order to grow?
That you can change. Just because something has worked well for years doesn't mean that you can't improve. If you've been operating at the same level continuously for a number of years, like, not saying that you're not declining, but then you're not elevating, you're just plateauing. Something has to be done. It's the definition of insanity, right? You're doing the same thing, you're going to get the same result, but expecting more. That's insane. That's what's really insane. So it taught me that, just because this theory may have worked, or this may have worked, in 1990 when you started, doesn't mean that it's still going to work in 2026. We've upgraded. Things have changed. Technology, people, thoughts, views, public opinion, things have changed, and it's important to continue to grow, modernize, and stay relevant. While I keep saying you stay true to your mission, that's important, but it's always a balance. I told you my Libra comes out, which means keeping your mission to what you initially said you wanted to do, and also updating with the times, staying relevant, staying hip, staying within the conversation, if you will.
So, you've seen good nonprofits and great nonprofits up close.
Mhm.
What is the essential difference? What is the ingredient, the quality, the practice, the mindset that elevates an organization from simply functioning to genuinely transformational?
Lines of communication and leadership, being able to not only you know, take a step back, whether it's something they need to listen, they have to do their own strategizing, their own strategic plan. That's where executive coaching comes in, just want to talk about what can we do to improve things, but also, being able to get your hands dirty too. You know, the best leaders I've ever had, and how I was taught by any supervisor, I've been really blessed to have some really great, supervisors, mentors, and coaches in my lifetime and in my career. That there was nothing that they would ask me to do that they wouldn't do, that they wouldn't support, that they haven't done. If they asked me, "Hey, can you do this?" They would literally like, "Okay, what can I do to be on your team? I know you're leading this. How do I support you?" And that speaks volumes when it comes from like your senior leadership. We're talking, C suites, SVP, those are folks that are coming down to roll up their sleeves. What can we do to make this a success? And that speaks volumes no matter what level of an organization that someone is in, to have that line of communication, to see that these people at the front line that are taking great pictures and doing speeches, they're there to support and help you. That speaks volumes, and that's morale, and that's what really builds a team.
So let's move over and let's talk a little bit now about this healthcare that you've been so involved with. Let's first talk about public health, your HIV advocacy, and the ending in the HIV epidemic initiative. How did you first get pulled into the HIV and infectious disease space? And was there a moment, a person, a case, a statistic that made you say, "This is where I need to be"?
Well, so I mentioned, when I was third grade, I just, it was the '90s, so sex was everywhere. People had condoms everywhere. It was less taboo, funny enough, back then than it feels like it can be in some spaces now. Um, and I just knew that the autoimmune, because my grandmother had lupus. I was just like, there's something about that, right? That just, I don't know why that stuck with me for a minute. But it was actually when I got to college. My later would soon to be boss, he used to come to campus and he would provide HIV tests, right? Scared college student, had a couple times where I went to school and there, you did, everybody was grown, right? So I was scared as I don't know what I took a test. And heck, then he was just really professional in how he like just talked to everyone. You just it was the way this man moved and made people comfortable about something that almost seemed so taboo, that it was amazing. And I just remember seeing him on campus several times, just say, "Hey, go get my test," and keep it moving. But this was funny. So we got to my senior year, last semester. Yeah, so I'm trying to graduate January. I need an internship bad in order to graduate from my minor. I had no internship. I hadn't talked to anyone. I didn't apply to anything. I'm just kind of going with the wind. Next thing you know, I'm in the student center and I see my soon to be supervisor. I was like, "Hey, how you doing?" I was like, "Yeah, how you been?" I said, "Look, I need an internship real bad. I'm trying to graduate. Um, my mom has already ordered already ordered the graduation party and the invitations. I gotta graduate, so I need an internship really bad." He was like, "Okay, like call me on Monday." Literally, I sent everything and called the other person I had to go through to get an internship. And it's funny, he told me later, he said, "Wow," he was like, "You were really serious. Like you really did the next day." I'm like, "Yeah, I need to graduate." And I started interning there, providing testing, counseling, HIV 101, sex talks, and all of that. Kind of became a health educator. The next thing you know, because I was so good at it, I was like, "Okay, this is normal and cool." He offered me a job. And it just kind of became and morphed into my career. I was like, "Okay, I'm here now." It just kind of fit. There was like those people, like it's a very special group of people in nonprofit and public health, specifically infectious diseases, and it was like y'all are kind of cool. I'm okay with this.
Wow. Black communities, particularly in the American South, carry a disproportionate burden of new HIV diagnoses in this country. What does it mean to work in a field where the weight of the epidemic falls so heavily on your own community?
It makes me want to fight harder. It makes me want to work harder. It makes me want to advocate more. Um, Honestly, that's why I got into the profession. That's why I stayed. I want to see us win. I want to see us healthy. I want to see us have access to care, access to treatment, access to prevention, to know the questions to ask. It became so personal and real. Um, I was when I started in HIV in the work when I got hired full time. I went to a meeting and I was chosen as like one of these 4 youth ambassadors to be a part of the work we're doing, work in HIV in the South. We were between a certain age, underneath 25 at the time. So, you know, at that time I was on 25, now I'm only 28. But then it was 4 of us that went down to Dallas for this meeting. And mind you, we stayed cool, we stayed close, and we talked over the years. But to know now that out of the 4 of us, I'm the only one who is not seroconverted. And what that means is them the only person who is not living with HIV. And to see that all of us at the time when we met weren't, but to see how that changes over time, that made it real because that hit home. These are people that I know. These are people that look like me, similar backgrounds. The one of the other guys, he actually went to Morehouse. So I'm like, we had that HBCU connect. I was like, what? Like, mind you, Atlanta and Nashville were like 3 hours and 45 minutes away. So, back then we played in the Classic. So, we were always in Atlanta. It really hit home that this is real, and this is something that I have to do something about. Like, I have to do something. This makes no sense with all the access to care, what's out there, what's available to people, that folks are still seroconverting when we don't have to, and especially in my community.
Yeah, that is a sad state, but so true. And I think the education that's been put out has been great, but it's not well received. And I'm not sure how is it that you actually get this out to the point that people really take it in here, because I don't think people are really getting it in the head.
You
That's my
know,
opinion.
so I often say this, and I feel like I've been quoted publicly saying this. I mean, I guess it's fine. But some of we've done a bit of a disservice in public health, especially around when I think about HIV, because we made it such, oh, this is a gay man's disease. When the initials itself, we're talking human immunodeficiency virus, which means all humans can contract HIV. And there are all types of humans that are living with HIV now, and several may or may not identify as same gender loving or not. But that doesn't mean, and we've done such a terrible job at promoting and just saying that, okay, we only want to do tests in gay communities, and we only want to do this at prides, and so that means you literally told an entire group of people that, oh, you don't need to be tested because you're not gay. Like, what sense does that make? But it's a human. Like, I've never understood that. Like, if you literally, one of my mentors, love this woman to this day. Best, she said, if you have sex, you can contract HIV, you can contract an STD. So that means if you're having sex as an adult, you should be tested. If you go for a physical, why aren't you asking for like, are you are you having sex? Then what, it's really that plain and simple. So that's definitely something I think I feel like we as a society has gotten better. We're getting better at developing a better message, but that's definitely been a shortcoming, I think, because a lot of folks still are like, why do I need to get tested? I've definitely given several of my family members, several men, an HIV test for the first time, um, just because they're like, yeah, no, you're an adult. You may you may have sex, so you should probably do this.
Yes. Um, Tell our viewers about the ending the HIV Epidemic Initiative. What is it? What does it actually do at the ground level? And why does it matter specifically for communities in the South?
So this was an initiative that was developed by the Trump administration, the first administration, and the idea was to have less than 5,000 new HIV cases in the United States a year. And by doing that, they were sending a lot of money to about 48 jurisdictions, millions of dollars, and most of those were between seven rural states they have quite rural population, and also that had something to do with also they had heavy opioid usage as well, and specifically several other county and cities, specifically with high incidence rates, which means high new cases of HIV, and then also some with high prevalence rates. That means those people that have been living with HIV for years. And the plan was to make sure that not only that people were being tested, if you didn't know, that everyone gets their HIV test in a lifetime, specifically in these areas, and then also those that are living with HIV, that they can reach viral suppression, because studies have proven that if you reach viral suppression, it is highly, I wish I could tell you the exact percentage that you can contract HIV with having sex with someone who has reached viral suppression. I really wish I could remember the numbers right now, but of course I can't. So that was the plan. And then, of course, when we talk about these areas, most of these are major cities and specifically large states. And all of these cities and states have a very high African American population, and majority of them are in the South. Six out of the seven states that were funded very heavily for EHE in the HIV epidemic, EHE, we say, were all southern states, and they all do also have high African American populations. So this is something that it involves us.
I know Georgia was one of those states, and can you also tell us when you're mentioning this, as in with the suppression, are you talking about the people that have become non-detectable?
So yes, the term. So you know, the medical term. The term is really like the non-detectable has become a slang word, but we really say viral depressed because you there are still you can still you'll HIV will still come up in a blood test if you're taking a test. But that's kind of the term non-detectable came up, but we really like to use the word virally suppressed, which means that you know your T load is down to a low percentage, which means your body is also not making more copies, and it's an autoimmune, so you're not also hurting your immune system.
Um, when you were working to help health departments integrate best practices and policies across jurisdictions, what were the systemic barriers you ran into? The institutional resistance, the bureaucratic walls, the cultural friction, and how did you navigate them?
Truly all the above, to be honest with you, and also it was a lot of mistrust that folks had with each other. Part of it was a lot of community mistrust and mistrust between some of the health departments. You know, a lot of things you working together with folks, and there were some things that have happened years ago, long before like people, including myself, like started working in the field, and there just may have been some bad blood. So one thing it that really we had to work on was a lot of relationship building with a lot of whether if it was community based organizations and health departments, really to make sure everyone understands that we're all on the same side, everybody's on the same team. There was a lot of money that was put into a lot of places that people hadn't seen before. This amount, this like large millions and millions of dollars that you know for honestly, a lot of people have been asking for better support for support services. Literally came in a blink of an eye. It literally just like popped in. That's what EHE did, and which is great and it's magical. But then the problem was because of bureaucratic policies, procedures, how things have been set up. It was like, okay, so what do we do with this? And I mean, there were certain places and certain rules that it was so bad as okay, you can only spend this amount of money per month on this thing because of this said rule that was in this bylaw that was created in like 1947. And I'm not even kidding when those were some of the things that we would run into. So it's like, okay, how do we work around that? And then it went into, well, let's have better relations with communities. Can we give them can we, classify this as a grant? Is this as a sponsorship? Like it really got to be really creative and working around some of those loopholes that we could. And really it came back to trust, really developing those relationships with each other, to trust each other, to do what we said we were going to do. A lot of that just started to happen in the field.
Let's talk a little bit about your work with your with MS and patient advocacy and health education. Your career has spanned multiple disease areas, from infectious disease to multiple sclerosis. How did you make that transition, and what did you carry with you from one field into the next?
It wasn't as hard because the one thing, MS is also autoimmune, but it there are different types of MS, and it shows up differently in different people. So that was, it the nerd in me, the researcher in me became, I had to say fascinating, but it's like I wanted to understand how things work, and learning completely a whole new disease, a new what are drug therapies, what does it look like, was really, it was eye opening. But one thing that I took for me, coming from infectious diseases and HIV, was specifically community voice and advocacy. The one thing I can say in the HIV community, um, you can't do anything without involving people living with HIV. And I think that's a beautiful thing, that, folks will make sure that you can't tell me what I need when you're not a person living with HIV. How do you know? I'm like, you how am I going to tell how am I going to tell you? You cannot. And that's one thing that I loved about that field, that I think that there were times that you would see people that were openly admitting in spaces that they were living with multiple sclerosis, but then also it was almost interesting. I think I see when there were people that weren't as open and wanted to advocate. There were advocates, but maybe not wanted to be as vocal. And that was a little shock to me, because just seeing from one space where it was very loud and vocal and proud, to like not completely. And I wanted to make sure that patients were always at the center, because if we're doing something for patients, then people living with MS should have a say so, should be here telling us this is this is exactly what I think people need.
So, what surprised you most about the MS community when you began working in that space? And specifically, what did you learn about the intersection of multiple sclerosis, race, and health disparities that the broader public does not know?
That the the highest incidence, so once back to the incidence, new cases of multiple sclerosis that are now being diagnosed, is in Black women. I was completely taken aback, did not realize, many folks like myself, we were taught, we learned, we only saw and heard of multiple sclerosis being in, mature late 40s, like white women. We hadn't seen a Black woman with multiple sclerosis, and not only just a Black woman. I mean, I'm talking, I met teenagers. There's a woman who was a phenomenal researcher, and she's a physician as well. She specifically specialized multiple sclerosis, but she was sharing when she tells her story and shares, her experience, how she found out when she was like 17, 19, like going to college. And I'm like, what? This is why I had no idea that this many Black women were living with multiple sclerosis. And I would often do health education talks and do programs across the country, a lot of specifically for African Americans. Let me tell you, some of the biggest cities that had a strong community that showed up, beside Atlanta, 125 African American patients in a room. And then Dallas, it was like 115, I want to say, in that room, and they were all African American patients that were living with multiple sclerosis and or care partners. And I was taken aback. I hadn't seen Jackson, Mississippi had 60 or so. It's I had not seen um so many people that looked like me, that looked like my family, that were living with MS and didn't know folks. Many of them didn't find folks that were saying they didn't learn until much later, because people still said that they didn't get MS because they were black, so they weren't treated sooner. It was quite shocking.
Let me ask you this because I find that to be interesting as well. Is there a connection between lupus and MS in Black women?
That's still a lot of research that's being done. I Now let me tell you, I'm not a complete researcher, so I can't look. Don't take anything. I'm not credible. Don't there is some research being done, and they're looking at some correlation and also possibly some studies. You keep following me, and you never know. There may be some things that may be coming up, because that's actually a really good point. But it's quite, yeah. There's actually quite a few folks, like African American women, that are living with multiple autoimmune diseases, which is becoming more and more common, like rheumatoid arthritis. Because, like I mentioned, my grandmother, she also had rheumatoid arthritis and lupus. So it's almost to the point there's not concrete evidence yet, but there has been studies on looking at correlation between, being with these comorbidities, if you will. Yeah, having multiple diseases. That's it.
So, how did you approach health education and resource development for MS patients? And what does it take to translate complex medical information into something that is generally useful and accessible for people who are navigating a diagnosis in real time?
Having partnerships, working with people. I worked with incredible group of African American Black doctors, actually all kind of doctors, that specifically did work in multiple sclerosis, and they would come with me. Listen, I could only tell you so much, but the way they would sit down and explain and talk about, the progress, what it looks like, some of the latest research that they were also involved in. These folks not only were like practicing and physicians that also were accepting new patients at the same time, they were also researchers. So they would go to other labs and be called to do other research and write papers and abstracts. Like, having a network and people that can share and talk is amazing. I tell everybody, if you really want to go far, what's the old saying go? You need to go. You don't go alone. They say, you can make $1 million by yourself. That's wonderful. It may take you 5 years, but you can make five with multiple people in less than a year. So it's all about collaboration and partnerships. And if I didn't have them, I would have did the best I could.
So let's talk a little bit about your personalized medicine genetic testing and the future of healthcare. Let's start at the beginning because most of our viewers have never heard the term. What exactly is personalized medicine, and why should every Black American be paying very close attention to it right now?
Personalized medicine is really, it's medicine that's specifically personalized for you. It's using genomic testing, literally you taking a blood sample, looking at your DNA, your makeup, and depending on your disease, what medicines, what formularies are going to support and to treat you best by your genetic makeup. This has often been seen in oncology and cancers for years, because there are several different trials and research trials that most people don't know about. But this is why it's important, because there are so many clinical trials, and also it's important. I know my people of color. I know y'all gonna look at me, and y'all might have questions and want to throw tomatoes, but I understand. but it's important that we become a part of these clinical trials. And because it's you can't deny that there are some differences between certain races and how certain races may adapt to one medicine versus another. Even it's very clear, as we've been talking about, that there have been seems that there are some diseases that may have been more prominent in one community versus the other. So that means we need people of these communities to be a part of these clinical trials to find out what medicines are going to work. And there are thousands of trials out there that so many folks don't know. And also, a lot of them do work and they have success, but because of certain restrictions, say like with FDA and others, and not saying that we need to change any of these restrictions, but you have to have so many cases, so much success in order to be, fully approved as this is a therapy for said disease or what have you. And then from that aspect, so I know I might be jumping ahead of some of your questions, but hopefully I'm getting there. And then at that aspect, also insurance to pay for it, because we all know, you need insurance to pay for things because certain things are very expensive. But this is something that we do need to be asking about and to be curious about, because it is moving outside of just cancer. Oncology, personalized medicine has been growing in several of the disease states. We're looking at different lung diseases, we're looking at infectious diseases as well, that they have been looking at how can we utilize your genomic testing to really support you. And that's something that if you're going to the doctor, you have said ask about. You can even call your insurance company to see if they cover it, if there is some reimbursement as well, which that's a whole nother fight for another day too.
So walk me through what your day to day looks like as a director of research strategy and partnerships at the Personalized Medicine Coalition. What does it mean to hold that title, and what are you actually fighting for when you show up to work?
It means that I'm fighting for each and every one of us, for us to be able to have these rights, for us to be able to know what we can ask for. I'm advocating on behalf of patients that are living with different diseases, different rare diseases, that are looking for treatment, looking for options in order to just live their life, to go back to, their sense of normalcy, to what does that look like. I'm oftentimes emailing folks, I'm connecting with folks, developing relationships and partnerships to how we can get some of this research out there. How can we make sure science is out there so this evidence is known? And even working with payers on, getting some reimbursements for some of this genomic testing in order to so we can tell you what are some medicines and drugs that you should be looking for, that you should be using to treat whatever ailment that you may have. My day, it varies, and it also almost looks the same every day. But the thing, when I say it looks the same, it's really showing up for people each and every day, patients everywhere. And it's the fight to make personalized medicine the standard of care. That's really our aim. This should be the new standard.
Yeah, but so like if with people that you think may be having some questions about this, what are some of the things that you think would add ease that situation to where the understanding could be that much more clear and concise as to why they should want to be a part of a trial?
You know, there, to be honest, it's such a small percentage of us that are in a lot of these clinical trials, which that's enough for, when I think for me, when like that means that we do need to be a part of these clinical trials, because these trials get approved and these medicines get approved and they become on the market. And then later on, we might find out that this medicine isn't working as well for you, then it may not work as well for like others in the community. Because it's honestly no secret, one drug, and when I think about it specifically, it's been found like a lot of people of color, we have hypertension, high blood pressure. So, one drug that a lot of people may get is lisinopril. Now, I'm not saying it doesn't work on everybody, but for some people, a lot of people of color, African Americans, it's been found that lisinopril does not work well for us at all. That amlodipine has by far been a better drug for people of color.
It's the
And
sulfur.
and because Lord knows I have a sulfur allergy, so that's another thing. So because of that, because there weren't enough of us in said clinical trials, some of this got passed to still like, okay, we still got a lot of drugs that have sulfur in it. And then even when I think about a lot of us, a lot of people of color, we have lactose issues. Thinking about how things are made, and if we're not being a part of these conversations and advocating, letting like, hey, we I'm not saying they're putting lactose in, but still, but our stomachs may dissolve and feel things differently based on our body composition. And it's not a secret. It's not something that people don't know, that people haven't talked about, that it's not, almost, if you want to say, you can say scientifically proven that some of our genetics happen to be certain different. I mean, you know, that's why we need to be a part of these studies, so we can find out what's going to work best for us. And I know I have I have also folks that have lived through like the Tuskegee trial, the Tuskegee experience. Let me be clear: the CDC experiment that was done at Tuskegee, because it was the CDC experiment, that syphilis experiment. And so I understand that we have a lot of hesitation, we have medical mistrust. I too feel that. But then also, with me fighting for us being on the other side, I do know that it's needed, that we are needed, our voices are needed, our opinions are needed. Because if we're not at the table where they're carving up the continent, then how do we get our slice? How do we get our say so? How do we say what borders which?
So when we talked before the show, and I told you we do Black History 365, I asked you who were the most influential people in your life and career. You mentioned Malcolm X, Marcus Garvey, and Barbara Jordan.
Mhm.
Can you tell us, um, Malcolm X is one of the most transformative and misunderstood figures in American history. Tell me what Malcolm means to you specifically, not as a historical symbol, but as someone whose philosophy of self determination, uncompromising truth telling, and radical Black dignity speaks directly to your work in public health and institutional leadership in 2026.
Honestly, you said it. You literally you said it. His unwavering change for Black excellence, for us to be treated as fair individuals, for us to be treated as the geniuses, as the people that we are, as the hardworking, as the faith loving, as the strong, independent people of color and proud people that we are. Um, I take that from him. That you know, just because that sometimes the system can be wrong. I'll say that. If that's what the system says, then no. Sometimes the system is wrong and it needs to be changed one way or the other. And that's actually why the other two actually speak volumes to me as well, because I'm not trying to jump ahead of you there, but because they didn't agree with the system, that just because it was built and this is what they say, these are the lines are, okay, that's what you say, but why? Why did you build those lines? And if that maybe, quote unquote, according to some people, said it worked in 17 whatever, but it doesn't work in 2026. So that means we need to change how things are done. And if you know anything about Barbara Jordan, that's one thing that she did. She was a legend in her own right for so many reasons, being a fighter of women's rights, African American rights, civil rights. Just when I say that, it was something to be a Black woman in the state of Texas, and she was at one point the president of the state Senate of Texas. That's something. She even sat a day as the governor of Texas, the only black woman to have sat as governor. She may have not been elected, but that is something to truly say. Um, all about make just because it says it doesn't mean that that's how things have to be done. And that's specifically, I had to, I didn't mean to jump ahead of you, but that's specifically why those three just really speak volumes to me. And then I think about Marcus Garvey. If you say, oh, well, you know what, we can go, we can build our, what, oh, that doesn't work. This is why my HBCU meant so much to me. You know, you say we weren't allowed here. There's too many of us that can't get into your school. So we built a school for us. We built a hospital that would serve us. We would continue to build things that support us. That's what we do in healthcare. That's what we do as a people.
So, Marcus Garvey's vision of Black economic independence, Pan African unity, and the importance of Black people building institutions for themselves. How does that vision live inside your work in nonprofit capacity building, partnership development, and community advocacy? Where do you see Garvey's fingerprints on what you do every day?
If it hasn't been built and we need to build it, if they say it doesn't exist, they say you can't sit at that table, build your own table. Is if you're not allowed to that coalition, that group, create your own. It's okay. Sometimes, some tables we may not want to sit in, but sometimes we make our own, we make a better table.
Barbara Jordan, the first Black Southern Black woman selected to the United States House of Representatives, a constitutional scholar of extraordinary power, and a voice that commanded rooms before rooms were ready to receive her. How does her model of policy mastery, moral authority, and speaking truth to power inform how you think about your own role in public service and advocacy?
Something about her, I know whenever she walked in a room, she commanded the room. And that's one thing I took from her. You not only walk into the room, you speak truth to power. You speak your truth. You're very direct. You're very humble. And there's nothing you can't do. There's not there's not there's not a hill you can't climb. There's not a policy you can't work with. There's not a person you can't find connection with. You can't find some type of synergy to find a resolution with. The Her art of facilitation, of speaking, of being an orator, of making compromise. It and really, when I say compromise, meaning she didn't really compromise much. She stood 10 toes down on what she believed in, what she thought was fair and right, and that's what you do in health. You stand for what's right. You stand for supporting patients, and I take that with me every day.
Final question for you. What does it mean practically, spiritually, professionally to carry the legacies of Malcolm X, Marcus Garvey, and Barbara Jordan into a conference room, a health department briefing, or a national coalition meeting in the year 2026? And how do you hold those legacies without letting them become ornaments?
They all walked in the room before me. It's really just my duty to not let them down, but to continue their work and their ideas, their theories in my own path. They all do. They all do really resonate with me throughout my life, throughout my career, my education, and every day I often think about not only what I can do to support my community, but sometimes what were some of my heroes think? What were some of my the people I look up? What would they do in today's time? They've been gone for some years now, but if they were standing here, how might they operate? What might they say to counteract that? You know, how would they write this policy into history? they'll never be ornament to me.
So, in words of, in closing, do you have any words of wisdom and encouragement for our audience? Can you tell them how to connect with you via social media, your websites, all of those good things?
Oh, website. I mean, you just find me on LinkedIn, Darion. That's probably the easiest because that's actually how we connected. Anything I'd like to leave behind, really support one another. Do what you can to support your community, to support your family. Always share any resources that you have. Um, and don't be afraid to ask for help, ask for a resource, ask for a connection. You never know. You never know who may be connected to who knows what. And that's even as simple as if you hit up in my inbox, hey, I have a question, I'm looking for a resource. I may not know the answer. I might not even know specifically what you're looking for, but I will send you somewhere that can at least get you to the next step.
So, as I'll get ready to close, I'm gonna do a closing monologue. If you could hang around for a few minutes after I close the show, I would definitely appreciate it.
Absolutely.
For those of you that have watched the show, I hope you guys have gotten a lot of wisdom and a lot of knowledge from what we've been told tonight. Um, Darion's work is more than just interesting. His work actually has a purpose that serves communities as a whole and as broad. I think the things that he just put out there, especially in learning, about genetic testing and, how things are now finding, new sources as to who's now more affiliated with different diseases and things of that nature, especially immune diseases. I hope you guys take that message strongly, take it seriously, and be actionable about what you want to do. For those of you that are watching on all of our channels, including our YouTube channels, if you have not yet subscribed and enabled all notifications, I will ask if you would please support us by subscribing to our channels, enabling all notifications, so that as we go live for each and every show, Monday through Friday, including the Saturday and Sunday shows, you will be able to get those shows live, as well as you're able to go back and watch all of our previous recorded shows with all of our great leaders, with all the great knowledge that you need to get you to the next level and to help you in community building. So as far as this closing monologue, Darion Banister, brother, I have to be honest with you and with everyone watching right now. This conversation has been exactly what this show was built for. You came in here tonight and you did not just answer questions, you told the truth about what personalized medicine means for Black patients who have been left out of clinical trials, left out of the economic databases, the genomic databases, left out of the rooms where the future of healthcare is being decided. The truth about what it costs you, emotionally and professionally, to stand inside the HIV epidemic and refuse to look away. The truth about what it means to build nonprofits that serve their communities rather than exploit them. And what it looks like to carry the intellectual courage of Malcolm X, the economic vision of Marcus Garvey, and the policy mastery of Barbara Jordan into every single room you walk into. You have given us something tonight that cannot be manufactured, and that is the real thing. If I were to distill what we heard tonight into its essential truth, it comes down to three things. First, systems change happens through community, not around it. Darion has spent more than a decade proving that the only sustainable path to health equity, to organizational strength, to any kind of institutional transformation runs directly through the people most affected. Second, the power of a Black professional who refuses to be separated from his community is not just inspiring, it is strategic. It is revolutionary. It is the living rebuttal to every system that told him his intellect and his identity were in tension. And third, the revolution of serving, choosing every single day to put your gifts in the service of something larger than personal advancement, is not a sacrifice. It is the highest form of power. Darion Banister is proof of that. If you are watching tonight and you're grinding away in a public health office, a nonprofit boardroom, a health department conference room, a community health clinic, or an advocacy organization, I need you to hear this. Your work matters. You matter. You are not invisible. You are, in fact, part of one of the largest and most consequential lineages in Black American life, the lineage of those who decided that their community's suffering would not be someone else's problem on their watch. You're carrying something sacred. On the hard days, and there will always be hard days, come back to why you started. Come back to the face of the person your work is for. Come back to the truth that Darion laid out tonight, that serving is not a diminishment of your power. It is the fullest expression of it. Before we close out, I need you to do something for me. If this conversation moved you, if something Darion said tonight landed in your chest and shifted something in you, share this episode. Tag someone who needs to hear it, drop a comment below, and tell us what resonated. Subscribe to America in Black and White so you never miss a conversation like this one, and keep the conversation going, because the most powerful thing any of us can do is refuse to let these truths stay in one room. Until next time, keep speaking truth, keep serving with purpose, and never forget your story is America's story. I'm Charles Zachary King, and this is America in Black and White. You all have a great evening. We will see you guys tomorrow evening at 6 p.m. Eastern Standard Time. You all have a great night.